Well, now to an ongoing issue that's only been made worse by the pandemic, mental health. Today, there are two big announcements on efforts to call attention to the problem and to combat it as well. CBS 6's JT Fetch joins us live now in the studio with a look at this. And JT, there is a statewide push, but there's also a local county that's hoping to get out in front of this.
Yeah, that's right, Greg. A dozen statewide groups are calling for New York State to do better when it comes to mental health and substance use and addiction services. This as Albany County announces a program expansion for response to mental health emergencies. First to the Capitol, and 12 groups known together as behavioral health advocates held a forum and virtual rally calling for Governor Hochul to include a 5.4% cost of living adjustment to the next state budget for community-based mental health and addiction care. The groups also want $500 million more invested. They say the state has failed for decades on this, leading to staff shortages and reduced access to care. At a more local level today, Albany County officials announced a $350,000 infusion of state funds to help with the Albany County Crisis Officials Responding and Diverting, or ACCORD program. The common theme, though, today, with the mental health side effects of the pandemic, this is needed now more than ever.
I'd love to throw all kinds of numbers at you, but a lot of our calls are mental health related, whether it's addiction, domestic violence, veterans suffering from PTSD.
Because of the lack of state funding, many of these positions are paid at minimum wage. Our members cannot compete with fast food and retail for employees. This is unsustainable.
The ACCORD program in Albany County is focused on improving the outcome of nonviolent emergency calls. Officials say the new state funding will offset staffing, equipment, and training costs. It will also allow police to focus on handling crime instead of those nonviolent emergency calls related to mental health. Officials say since the program launched last June in the hill towns, more than 100 people have been helped. And